So here we can see corneal massage being done in two different patients, and it is being done for completely two different reasons, which we will see in this video. We present a case of Bowman-Stroman inlay where the donor tissue was further dissected to be used in DSEK. 21-year-old female presented to us with progressive diminution of vision in left eye. She was diagnosed with keratoconus. On topography, her pachymetry was 364 microns and K max was 66.4 diopters. Hence, she needed treatment for keratoconus. So the options were to do a CXL, but with her topography, the CXL could not have been very efficacious, as it has been seen that the effectiveness is not very good in cases of steep cornea. The other option was Bowman layer transplantation. It has been found to have good results in patients with steep cornea and thin pachymetry, but the problem lies that it has a longer learning curve. The surgery is technically very challenging as well. The other option is BSI, which is the Bowman-Stromal inlay. We have previously published a technique where the Bowman's layer is injected in the stromal pocket of the recipient along with anterior stroma. The epithelium of the donor cornea is removed, after which the femtosecond laser is fired and an inlay is harvested, which includes the Bowman's layer and the anterior stroma of the donor cornea, which is then injected in the stromal pocket which is created in the recipient by the femtosecond laser. Here we can see the femtosecond laser being fired on the donor cornea, which is mounted on an artificial anterior chamber. In a modified technique, the excimer laser is fired on the stromal side of the inlay to make the inlay into a negative meniscus shape to improve the refractive outcomes after the surgery. So after the inlay is harvested, it is placed in a Teflon block in BSS, after which it is inserted in the stromal pocket of the recipient. Here we can see that the inlay was inserted in the stromal pocket of the recipient with the help of an IOL injector. The inlay was opened up in the stromal pocket and centration was ensured with the center of the patient's pupil. Surface massage was done to ensure the centration of the inlay. Here we can see the post-op 3 months image of the patient where the inlay can be seen well in the center and there is no inlay edema. The cornea is clear and compact, as can be appreciated on the anterior segment OCT as well. The keratometry decreased from 56.9 to 51 diopter, as well as the improvement in refraction was also seen. Q value also improved after the surgery. Hence, CBSI helps in progressive advanced keratoconus by providing stabilization to ectatic corneas. But it's not still over yet, because after harvesting this inlay, we realized that the donor cornea with a good endothelial cell count is still available with us. So we actually mounted it on a different artificial anterior chamber. After putting an incision of 5 mm on the posterior limbus, the initial dissection was done with the crescent. The care has to be taken while dissecting this tissue because there is differential thickness in this particular donor cornea, where the center is thin as compared to the periphery, which is comparatively thicker. We have to be careful while creating the plane of dissection because there are high chances of buttonhole or Descemet's membrane perforation because of this particular differential thickness in the center and periphery. The dissection was advanced with straight lamellar dissector till the dome of the cornea, like it is done while harvesting a normal DSEK tissue. In similar manner, the dissection is completed till the periphery. After the dome of the cornea, the dissection is completed with a curved lamellar dissector. At the end, we have to ensure that limbus to limbus lamellar dissection is complete. At the end of dissection, the curved dissector is moved in all directions to ensure it crosses limbus in all directions. This lenticule was then implanted in a patient of post-penetrating keratoplasty graft edema, where the surgery was performed like a normal DSEK surgery. So as we have seen in the course of this video, this particular lenticule had been exposed to femtosecond laser, excimer laser and also applanation while the inlay was being harvested on the femtosecond machine. But as we will see, this patient after surgery has been doing well. The graft has cleared, there is no edema, and the patient has been doing well, and improvement in vision has also been seen. These are the post-operative photographs of the patient. As well as on the OCT we can see that the inlay has been doing well. The cornea is clear and compact. Thank you.